Distinguished guests, colleagues, ladies and gentlemen, welcome to the regional workshop on accelerating AMR action through antimicrobial stewardship in the Eastern Mediterranean region. My name is Sabiha Isaac. I'm chairperson of the Global Respiratory Infection Partnership, sponsored by an unrestricted educational grant from Reckitt in the United Kingdom. Reckitt has sponsored this pharmacy-led stewardship initiative in partnership with the International Pharmacy Federation since 2019. It is my great pleasure to introduce the AMR advocates for the region who will be facilitating the workshop. Dalal Hammoudi is a registered pharmacist and holds master's and PhD degrees in pharmaceutical and biological sciences, specifically microbiology and infectious agents. She is the Associate Dean for Assessment at the School of Pharmacy, Lebanese International University. Dr. Hammoudi is a member of the FIP Women in Pharmacy, Science and Education, FIP WISE, and member of the FIP Antimicrobial Resistance Commission, where she will lead the regional engagement of the Commission for the Eastern Mediterranean region. Nada Ahmed is a pharmacist who recently obtained her PhD degree in microbiology from Alexandria University in Egypt. Her research focuses on antimicrobial resistance using a One Health approach, and she's also interested in science communication and game-based learning. Dr. Ahmed is currently working on a project with SAS Africa that aims to develop games to raise awareness about AMR. Khalid Eljaaly is an associate professor in the Faculty of Pharmacy at King Abdul Aziz University in Jeddah, Saudi Arabia. He's an infectious disease pharmacy consultant, chairman of the ID Pharmacy Specialty Network of the Saudi Society of Clinical Pharmacy, as well as an honorary research fellow in the College of Pharmacy at the University of Arizona in Tucson. Dr. Eljaaly is a member of the American College of Clinical Pharmacy Scientific Program Committee for its 2022 Global Conference and editorial board member of Antimicrobial Stewardship and Healthcare Epidemiology. Khalid received the 2021 Shea International Scholarship Award as the first pharmacist receiving this award. With those words of introduction, I hand over to Dr. Hammoudi to take you through the workshop.
Thank you, Sabiha, for the introduction, and I would like to sincerely thank the FIP for giving us the opportunity to showcase today the progress regarding antimicrobial stewardship in the Eastern Mediterranean region. So thank you, Sabiha, again, and welcome, dear colleagues. This is the agenda of this workshop. So we're going to go over to roadmap and roadmap progress in the Eastern Mediterranean region, which is going to be handled by my colleagues Khalid and Nada. After this roadmap, we're going to go over to a panel discussion in which we will showcase 3 of the best initiatives done in the Eastern Mediterranean region in terms of antimicrobial stewardship, and our panelists will be in charge of introducing these case studies. Finally, we will be very happy to take your questions for a small discussion, and then we will close. So in the next slide, I'm going to highlight the objectives of the Eastern Mediterranean workshop on antimicrobial stewardship. So we're going to highlight the leadership role of pharmacists regarding antimicrobial stewardship. We're going to see how it is possible in the region to drive the behavioral change and the commitment to the initiatives of AMR through a roadmap that is going to be developed over 3 years. And we will be happy to share the learnings and the best practices across our region to inform the future initiatives for the prevention of AMR, and to basically touch base on how can these initiatives be more broadly used. So I will move over now to the next slide, in which my colleague Nada is going to show the roadmap. Over to you, Nada.
Thank you so much, Dalal. So hello, everyone, and thank you all for attending today. So last year, a roadmap for fighting antimicrobial resistance in the AMR region was developed, and it included 7 proposed initiatives. So what has been achieved during the past year and what needs more work over the next 2 years that we will be reviewing now. So next slide, please. Yeah, and so the first initiative was to provide simplified education to the patients and the public about antimicrobial resistance. And what has been achieved over the past year was first in Saudi Arabia, where the Society of Clinical Pharmacy created infographics and an infographic video to raise awareness about the proper use of antimicrobials. And now with Khalid to tell us more about this.
Okay, so as the chairman of the Infectious Disease Pharmacy Specialty Network in the Saudi Society of Clinical Pharmacy, we wanted to create some simplified patient education materials like infographics in Arabic, because when we looked online, we found limited infographics and educational materials in Arabic. They have variable quality, and very limited materials were done by pharmacy groups or pharmacy organizations. So we wanted to enrich these materials. So we created an infographic simplified on the proper use of antibiotics. If you can see the photo or the picture. Okay, so this is it, the infographic in Arabic. Simplified. It was also shared during the antibiotic awareness week last year. After we talked about the importance of awareness, so we worked on this and we distributed this. Next. We also worked on a video, also simplified in an Arabic language, and we distributed this video about the anti-tuberculosis medications during the World TB Day. Next, if you can see the picture. Excellent. Yeah, this is the video. You can find it in YouTube. It's a short one, less than 3 minutes for the public. Next.
Okay. Thank you,
handing back to Nada. Thank you.
Yes, thank you so much. And in addition to Saudi Arabia, also in Lebanon, a school of pharmacy celebrates the World Antimicrobial Awareness Week, with the students raising awareness about antimicrobial resistance using games, videos, and educational posters. And we will know more details about this initiative later on in the presentation. So next, please. And in Egypt, also during the World Antimicrobial Awareness Week, a campaign was implemented by Mersal Foundation, which is one of the biggest NGOs in the country. It included raising public awareness in 3 large shopping malls about the antimicrobial resistance, the proper use of antimicrobials, and the proper infection control measures. Next, please. And for the way forward over the next 2 years, what needs to be done is to provide additional education in different languages or in different dialects in order to raise awareness using awareness campaigns or TV ads to engage more public and to engage more key stakeholders. Next, please. And the second initiative was to include interactive lectures about antimicrobial resistance into the undergraduate curricula in the schools of medicine and pharmacy. And what has been done over 2021 was first, yes, next please, yes, was first in Saudi Arabia in the Faculty of Pharmacy, King Abdulaziz University, where 2 lectures were added to the PharmD curriculum for the 5th year students. The first lecture was about antimicrobial resistance, and the second was about antimicrobial stewardship. And also in Egypt, the topic of antimicrobial resistance has been incorporated into the undergraduate curricula in the schools of pharmacy, medicine, and dentistry. And for the next 2 years, what needs to be done is to involve more schools in the region and to include topics about antimicrobial resistance and in particular about antimicrobial stewardship. Next, please. So the third initiative was to provide an official certification about antimicrobial stewardship for both community and hospital pharmacists. Actually, this initiative has not yet been achieved. However, several courses and workshops have been provided to hospital pharmacists only about antimicrobial stewardship But what needs to be done over the next 2 years is to provide an official training with a final examination and certification by one of the official institutions in the region. And the next initiative was to properly dispose the waste in the community pharmacies and to use suitable containers for the disposal of shards. Unfortunately, this initiative has not yet been achieved. So for the next 2 years, what needs to be done is to implement strict infection control measures in order to properly dispose the pharmacy waste and to use the proper containers for the disposal of sharp objects. Next, please. And the next initiative was for the community pharmacy to be a hub for services by encouraging the public to receive vaccinations, in particular the flu vaccination, and to provide in-pharmacy services and in-pharmacy diagnostic tests. And what has been done during the past year was first in Saudi Arabia, where the Ministry of Health and the Saudi Society of Clinical Pharmacy provided a certification for community pharmacists so that they are able to safely provide immunization to the public. And also in Egypt and Lebanon, many pharmacies have been providing in-pharmacy services, including the flu vaccination. So what needs to be done over the next 2 years is to expand the immunization services provided in the community pharmacies in the region, and maybe to engage more countries into providing certification and training to community pharmacists so they can be able to safely provide immunization in the community pharmacies. Next, please. The next initiative was to either set a new law or to reinforce an existing law to prohibit dispensing antimicrobials without prescription. What has been done in the region was in Saudi Arabia, where a policy for prescription-only antimicrobial dispensing was enforced so that antimicrobial dispensing is restricted to prescription only, and that actually had positive consequences that were reported in a new study that found out that intervention was associated with real reduction in the rates of antimicrobial use in the country. In Egypt, that initiative has not yet been achieved. However, some steps have been taken, such as the national guidelines that are now under development in the country for the proper antimicrobial use that should be published soon. And for the next 2 years, more countries in the region need to implement a policy that prohibits dispensing antimicrobials without prescription, and to either reinforce an old law or to set a new law for that. Next, please. And the seventh and final initiative was the Telehealth Train the Trainer. This initiative has not yet been achieved across the region, but some steps have been taken across the region, such as, for example, in Egypt, the Egyptian Drug Authority have trained more than 1,200 pharmacists so that they are able to train the patients for the proper infection control measures and the proper use of antimicrobials. That's added to many virtual events that have been carried out in different countries in the region, such as Lebanon and United Arab Emirates. And for the way forward, over the next 2 years, grants or resources need to be secured in order to facilitate the implementation of that initiative. Next, please. And now we are back to Dalal to introduce to us the panel discussion. Thank you all.
Thank you very much, Nada, for this nice elaboration of the initiatives that have been achieved in 2021. Actually, when we work meticulously on the initiatives and put them together in a document, we will be able to see what really has been done, and we will be able to effectively plan, as you said, the way forward for the next coming years. I would also like to thank Khalid for his comments from his experience on the progress of the roadmap. Also, I am happy to tell you that I have started to see initiatives that are shared in the chat, for example, about some non-governmental organizations, and all our attendees are welcome to share their experience and their initiatives in order to benefit everyone from what has been done in order to manage this global public health concern. We are happy now to move to our panel discussion entitled Antimicrobial Stewardship in Action. In this panel discussion, we're gonna highlight 3 best case studies or initiatives from the Eastern Mediterranean region which have tried to advocate for antimicrobial stewardship. I am happy to introduce our panelists, Dr. Umayma Arab, Dr. Samar Yunus, and Dr. Khalid, who is also our AMR advocate. So next, please. So Dr. Khalid, as nicely introduced previously by Dr. Sabiha, we are so happy to have you with us and to present your case study. Our next panelist is Dr. Umayma Al-Arab. Dr. Umayma Arab earned her bachelor's degree in pharmaceutical science from King Saud University at KSA. After graduation, she worked at King Faisal Specialist Hospital and Research Center. Then she accepted scholarship to the States, where she has earned a Doctor of Pharmacy degree. Then she completed postdoctoral training in general clinical pharmacy residency at Columbus Regional Health, followed by ambulatory care residency at Piedmont Columbus Regional. She is triple American board certified, specialist in pharmacotherapy, medication therapy management, and ambulatory care pharmacy. She held the Ministry of Saudi Public Health Immunization Delivery Certificate during COVID-19 pandemic, and she was selected to lead the Medication Therapy Management Certification. She serves as the chair of the Ambulatory Care Pharmacy Specialty Network of the Saudi Society of Clinical Pharmacy. Currently, Dr. Umayma is an ambulatory care clinical pharmacist at King Faisal Specialist Hospital and Research Center. She has participated in several events as a speaker and facilitator, in addition to conducting research. Our third panelist is Dr. Samar Yunus. Dr. Yunus is a registered pharmacist who earned her Bachelor of Pharmacy degree in 2009 and her PharmD degree in 2011 from the Lebanese International University School of Pharmacy. She also holds a research master degree in pharmaceutical biotechnology from the Lebanese University since 2018. Dr. Yunus is a clinical associate professor at the Lebanese International University, and since 2014, she was appointed as the assistant dean at the School of Pharmacy in Bika campus. Currently, Dr. Yunus is the chairperson of the Biomedical Sciences Department and has earned experience as course instructor among various courses such as pharmacology, pharmacotherapeutics, and pharmacy practice experience. She is a member of the Lebanese Order of Pharmacists, the International Pharmaceutical Federation, and the American Association of the Colleges of Pharmacy. Dear panelists, we are so happy to hear from you today. So in the next slide, we're gonna pass to the first case study, and I'm gonna invite Dr. Umayma to present, please, her initiative. Over to you, Dr. Umayma.
Well, thank you so much, Dr. Dalal. Can you hear me well?
Yes, we can hear you.
All right. Well, thank you so much again for this kind introduction. It is my great pleasure to be presenting today our success story here in Saudi Arabia, and describing the implementation of the pharmacy-based immunization program. And I would be also describing the setting of the training and indicate the program expectation and outcomes. So pharmacists here in Saudi Arabia, to begin with, they are very well known to be promoting and educating for vaccines. However, we know that we are the drug experts in this sector, but we are not really we are not allowed to do vaccination as administrating vaccines in any setting. So the initiative was done was started in March 2021 when the government, the Saudi government, released this new regulation where it allows pharmacists in all settings to get this training and help in the vaccination, especially during the pandemic. So the program was actually in the implementation phase, but before the pandemic, when the pandemic has invaded and we needed more people to participate in the national campaign for COVID vaccination, the program was rushed and it was top priority. So we actually created this program for vaccination and training to be the pharmacists to be vaccinators. To begin with here, the Ministry of Health has invited different pharmacy, clinical pharmacists in different institutions with backgrounds of ambulatory care, infectious diseases, clinical pharmacists with a strong background in immunization, those actually who wrote the protocol. Their expertise were very helpful in building the protocol. The immunization protocol actually was based on high level of immunization standards to achieve proper vaccine administration and to ensure safe and effective vaccination. Then it was carried to the Saudi FDA to comply with the major rules and regulations, especially when we were talking about space requirements, anaphylaxis management, and those types of things. And then it was passed to the Saudi Society of Clinical Pharmacy to execute the workshop. The workshop was done and created within a few weeks, and it was passed again, but this time to the Saudi Commission for Healthcare Specialties for accreditation and CMEs. After that, it was completely ready, and within a few weeks, it was live and accepting trainees. So that way, we actually were able to activate pharmacist role in all settings, and we're targeting community pharmacies. As I mentioned, it was based on high level of immunization standards. We're talking here about the CDC, WHO, and ACIP. Basically, all the material were collected and gathered based here for the knowledge base and the skills, the soft skills that were needed for the pharmacists to begin with this campaign. The program consists of self-assessment questions. It has the theoretical part where it is presentations. It is loaded, available on the platform where they can watch the presentation, take the material from there, and then when they pass the questions and the assessments, they can go ahead with the next stage where they can schedule their hands-on training. So the hands-on training, they have to be available for the training and get the training for injections, safe needle use. And after that, they have to successfully pass more than 70% of the program so they can actually get the certification. And for quality purposes, we have the survey. We get this information from our trainees so we can improve for the future. I want to mention that we have built this program for adult vaccination. We have 9 major vaccines like pneumonia vaccines, meningitis, tetanus, and because of the pandemic, we have a specific module that is COVID vaccine focused. And these vaccines are all targeting adult individuals. And those are, we're talking about elderly, pregnant, pilgrims, especially when they come for the time when it's Umrah and Hajj. So travelers also are part of those targeted groups. Now, I'm really happy to mention that here we have to date 13 trainers who were able to train about 300 pharmacists who were able to give about 163,000 vaccines to date since March 2021. And geographical locations, you can see here in this small map, it was located and still located in the major cities, the MAM. Those pharmacists were able to participate in their locations where it was, whether the eastern region, north or west region. The south region, we have the empty quarters, so it's not, there's no people around the area, but we try to cover most of the geographical locations across the country. And with that, we were able to participate in the national campaign of COVID vaccination here for residents and citizens. With that, I complete my case study and happy to answer your questions at the end of this case studies.
Thank you so much, Umayma, for sharing with us such a great initiative. And now we will move to Summer to tell us about the second case study.
Thank you, Dr. Nada. Hello, everyone. So thank you, Dr. Dalal, for the introduction. And I would like to thank you for inviting me to share our school's initiative about AMR. However, before discussing our current initiative, I'll show you what had inspired us to go for it. We at the School of Pharmacy at the Lebanese International University drive our students to be responsible healthcare providers and lifelong learners. We empower the students to develop health awareness and to engage in cultural and environmental sustainability through maximized health awareness and to engage in resources, which is one of the school's core values. Every year, the extracurricular committee at SOP organizes a number of health awareness campaigns in line with the WHO Health Days on a nationwide level to advance pharmacy education, promote community well-being, and advocate for the role of the pharmacist nationally. As for the World Antimicrobial Awareness Week that is celebrated annually, a previous experience at our school was done earlier, when the School of Pharmacy organized a face-to-face event to raise awareness about AMR. What happened in this event? So this event consisted of students teaming up to create posters about AMR inspired by the WHO initiative. Each team prepared a poster and was given a physical site to present it in the university hall, which was accessible to all students. Also, games related to AMR were launched, including a search for most resistant bacteria, as well as role plays and other fun and entertainment activities, as you can see in this slide. Next slide, please. So inspired by this original event, and in November 2020, students were encouraged to create a campaign in the occasion of WOW. However, to do it virtually, as all curricular and extracurricular activities in Lebanon at that time were shifted to virtual mode due to COVID-19 and the imposed lockdown. This campaign was conducted with an aim to change antibiotic behaviors of the public, also to raise awareness about sticking to the correct antimicrobial regimen, prophylactic measures, and proper sanitization, and educate the public regarding the problem of AMR and mitigation of its further spread. So faculty and students, they coordinated to record 6 short videos addressing the problem of AMR and posting these videos on the school's official social media to raise the voice about AMR with an aim to influence students, pharmacists, and the public. So a focus group of students, which was formed from the Pharmacy Student Club, our family in the school, discussed with the instructors the contents of the videos and what important data to expose about AMR to the public. The campaign started with an introductory video, which is Stay Tuned on the first day of WOW. Then 4 videos were posted on different days during the week. Students self-recorded the videos and they did the editing and the design tasks by themselves. Finally, a wrap-up video was created from the 4 videos as a recap of the campaign and posted on social media at the end of WOW. What were the main themes of the videos? So they were sticking to the right antimicrobial with the right dosing and duration, influence of incomplete antimicrobial treatment courses on development of resistance, importance of prophylactic measures of infection to reduce antimicrobial use, thereby reducing the emergence of resistance, and importance of hand washing and sanitation measures, especially in the context of COVID-19. Next slide, please. What was the impact of our initiative? This was the first virtual AMR awareness campaign in the region, which is led by pharmacy students, where the voice about AMR was raised and the number of views of the videos reached over 2,500 and still counting. As Benjamin Franklin says, tell me and I forget, teach me and I may remember, involve me and I learn. So it could be said that Franklin's statement nicely sums up the teaching methods that are actively employed at our school to engage and encourage students and make learning more memorable. Also, a major learning from this initiative is the consideration of the power of social initiatives in raising awareness in AMR as a result of accessibility and use by the young population. Also, the use of lay language, simple terms, audio-visual means, and social media to describe AMR basic information is effective and it's easily grasped by the public. So perhaps education about AMR should be utilized by stakeholders and decision makers to change perception of the public and thereby to modify incorrect practices that drive AMR. And this initiative can be replicated in other settings in order to further raise the voice about AMR and enhance its awareness. Next slide, please. So finally, these are screenshots of the posted videos throughout the World Antimicrobial Awareness Week. So as we mentioned, every day during the WOW, students were posting a video with a different theme. Students were using Arabic language, which is the Lebanese official national language. However, the videos were translated to English to grasp more audience. And thank you all for your attention.
Thank you so much, Samar, for sharing that great initiative with us. And now we're moving to Khalid to tell us about the third initiative.
Okay, and now we have the third initiative, case number 3. And I think it's very important because we talk a lot about it in the Eastern Mediterranean region. And we always say you should not get antibiotic without a prescription. And we have several publications in the Eastern Mediterranean region about the antibiotic dispensing in community pharmacy without a prescription. However, still, unfortunately, most countries in the region either don't have the law or regulations to prohibit this dispensing without prescription, or we have the law is there, but it's not enforced. This was the case in Saudi, in which we had the law since long time. You will read in the community pharmacies that antibiotics needs prescription, but still the pharmacist will give you the antibiotic without a prescription because the law was not enforced well, and there was no punishment if you do that. And if there is no punishment or serious consequences for those who dispense antibiotic without prescription, it's going to continue. It's going to continue. And with all our efforts in the last few years to increase awareness, still, if there is no enforcement, it's difficult and it's going to continue. And if you just increase awareness, whether for pharmacists or for the public, the impact would be limited. Several studies in several cities in Saudi, and I'm sure in most countries there are similar studies, they showed that antibiotics are dispensed without prescription in the majority of cases. Some studies showed percentage almost 100%. But gladly, before 3 years, this was discussed extensively. And finally, the law was enforced in a new policy by the Saudi Ministry of Health with clear punishment this time. And I was very honored to have been a member of the National Antibiotic Committee at that time. What are the punishments? Well, pharmacists who violate the law are liable to be punished with a fine of up to around 100,000 riyal, which is equivalent to 27,000 US dollar. In addition, not only that, imprisonment of up to 6 months, and finally, revoking of their pharmacy license. Of course, after this, punishments, people really stopped to dispense antibiotic without a prescription. And this conforms to the tactical approach adopted by many countries across the globe to develop their own policies encompassing legislative changes regarding prescription requirements, reimbursement restrictions, and professional regulations. So we wanted to, after that, we wanted to evaluate the impact of this policy on antibiotic use. And to be honest with you, in the beginning, it was difficult. But finally, we were able to get the national data for yearly sales, consumption of antibiotics, and antimicrobial claims in the community pharmacy. And in addition, we calculated DDD, and this was the first time this is done nationally in Saudi. So what was the findings from, after this policy enforcement and in our study? So we found that, as expected, the most commonly used antibiotics, whether before or after the policy, was the penicillins, mainly amoxicillin, with or without clavulanic acid. This was number one. As you know, it's used frequently, mainly for respiratory infections, although most of them are viral. After that, I believe it was metronidazole, which is used commonly in the Eastern Mediterranean region as a treatment for diarrhea, although it's not a treatment for diarrhea. Many believe in our region for some reason that it is a disinfectant. It's not an antibiotic, and this is wrong. It is an antibiotic, and guess what? It doesn't help with most diarrhea. Most diarrhea are because of if it's infectious, it's viral. And if they are not viral, if they are bacterial, mostly caused by gram-negative. Metronidazole does not cover gram-negative. So after this policy, gladly, its use also was reduced. If you look at the overall antibiotic utilization, sales or DDD, overall, it was declined by about 10%. And if you divide by 1,000 inhabitants per day, it's about 17% reduction. So the policy was effective. It decreased when you decrease the utilization nationally, when you reduce it by even 1%, it's huge. In this case, it was reduced by 10%. If you look at the DDD or sales. If you look at the number of antimicrobial claims, this one increased, of course, because, and this is just a decline in antimicrobial dispensing without prescription. So you will see more claims because now people are trying to get the prescription for their antibiotics. Interestingly, if you look at the figure, so you will see here the figure. In the middle, you will see the time of the restriction of antibiotic prescription, and then you'll see before and after. So of course it goes up and down. Mainly it increased around the winter months, and this is expected whether before or after the policy due to outbreaks of viral infections. But interestingly, this is something we learned from our study. Look after the enforcement of the policy. You will see a sudden drop in consumption immediately after policy enforcement, and even a little bit before the policy enforcement, because people hear that this law gonna come, so we have to start, not dispensing antibiotics without prescription before we get any punishment. But after this sudden drop in consumption, unfortunately, the use increased again. It's still better than before, but it increased again. So we learn from this something very important. Merely enforcing strict policies or regulations may not be sufficient to address antibiotic misuse. It is one of the things we could do. It is great, it is effective, but also we need to implement educational and training programs for patients, physicians, and pharmacists to raise awareness of appropriate use of antimicrobials and to maximize the effectiveness of these policies. By the way, last year in our region workshop, people voted that this policy enforcement is badly needed, and it was one of the top priorities in our region, as you saw in the roadmap based on your voting. And this year, I'm very glad I could present this data. And I presented this study in the IDE Week, one of the Infectious Disease Society of America conference last month. And I wished to share the published paper, but it's not published yet. It's currently under peer review. So stay tuned for that. And a message to the countries in our region, in the Eastern Mediterranean region. It can be done. Keep pushing, keep pushing. It can be done. If you know someone, reach to people and try to push for this until it happens in your country. I remember before this policy, I kept giving lectures in national conferences about this. We need to do this. And I'm glad to see it now happening. And as you saw, it is effective. We hope that the decline in antimicrobial use was more than that, more than 10%. But this is not enough alone. So it helps, but you also need to work with the physicians and the public, because people found a way to get antibiotics with prescriptions from some physicians. Okay, so if you just prohibit dispensing without a prescription in the community pharmacy, it's not the end of the story, because many physicians, unfortunately, still they prescribe antibiotics for respiratory infections, even viral. The public keep pushing and asking for those antibiotics. So please continue to spread the awareness and other strategies to tackle antimicrobial resistance and optimize antimicrobial use. This was our case. Thank you.
Thank you, Khalid. Thank you, Umayma, and thank you, Samar, for this nice sharing of the 3 case studies from our region. Indeed, I agree with you that a consolidated effort between education, management, and also policy is needed in order to maintain the efforts towards antimicrobial stewardship. We will be happy now to take questions from the audience. I guess maybe Samar would like to answer a question from Adrian Shepard. See you with us virtually. Adrian is asking Samar, do you believe that the students involved in generation of the videos will be keen to drive future AMR initiatives? And did the video stimulate social sharing by the audience? Over to you, Samar.
Thank you, Andrian, for your question. So we usually at the school drive to provide highly effective extracurricular activities and experiences for our students to foster their leadership and professional development. And also we engage our students in decision-making where we have representatives in all our committees, and one of them is the extracurricular committee. So my answer would be for sure. I do believe that these students who participated in the generation of the videos will play a major role in driving further initiatives about AMR and raising the voice about AMR in order to reduce its spread and enhance its awareness. As for the videos which were shared by the school's social media, they were also shared by the students, by the families, by the relatives, and the spread of the AMR was also enhanced by using the social media. Thank you.
Thank you, Samar. And there is a question for Khalid about the punishment and how the compliance went. How many pharmacists have been punished so far?
Okay, good question. So I don't know how many pharmacists exactly were punished. I hope no one. I hope everyone followed the law, and I hope not much got punished. I have no idea if like how many got punished. I mean, I hear stuff, but I don't know how many exactly got punished. I think people got scared, and they finally followed the law, and now it's very difficult, like, to get this antibiotic without prescription. I haven't seen published studies about that after the policy, but we know that in our community in Saudi, that when you go now to community pharmacy, pharmacists will reject, unlike before the policy. Almost anyone who asked before, they can get antibiotics. But again, this was enforced by the government, and they are following up on that. There are some some visits about this to make sure nobody is doing that. Again, what was the punishment? Some people in the beginning, I remember, they thought this was very strict, very harsh punishment. But I think because you need some sort of punishment sometime to enforce. So again, it was fines of up to $27,000 US plus imprisonment for up to 6 months. plus revoking the pharmacy license. So I don't think people took the risk.
Thank you so much, Khalid. And there is another question for you, Khalid, if you please. Yes, did the reduction in antimicrobial use due to that policy affected the number of patients admitted to the hospitals? If you have any idea about that?
Okay, this is another excellent question. And actually, I had the same questions, and all our team, which was led, by the way, by Prof. Ahmed Eljaaly, we're wondering about this. Now, from our study, can we tell the answer about this? No, we can't. The study was not designed to answer this, and it's very difficult actually to answer this because we don't have the data. So it's difficult to get the data for something like that. In most countries, I believe. We were barely able to get the utilization data. And even this one was difficult. And we thought at some point we are not gonna get it maybe, but I'm glad we were able to get it and complete the analysis for the utilization. But clinical outcomes, admission to the hospital, antimicrobial resistance nationally, for all of this, we don't have an answer. We expect when the antibiotic use decrease, antimicrobial resistance should go down, based on other studies and based on what we know about the bacteria. But we don't have a confirmation from data from Saudi, and it's very difficult to get, unfortunately.
Okay, thank you so much, Khalid. And may I have a question to Umayma, please? Question from me. Yes. Was there a resistance from patients to receive vaccination in the community pharmacies?
Well, this is really, really good question. We were afraid if we would have resistance from pharmacists and patients when we go to the community. Pharmacists, we had actually a majority of our pharmacists who got trained outside for vaccination. So they had these skills, the interviewing skills, the administration skills, and how to counsel patients. So that made it easier for patients actually to perceive pharmacists as vaccinators. Now, there has been some studies, it is very small ones here in Saudi Arabia, talking about the diverse patients or individuals in the community who were asked about pharmacists as a vaccinator. It showed variable outcomes. It didn't really specify if they really like pharmacists as vaccinators versus not. But I want to say that there has been also some studies that showed that pharmacists are very accessible, and I want to say they answered all the questions. They know the patient's background, so that in that manner, actually, they were repeatedly shown as perceived professional for being vaccinators. Now, in our program, we are collecting data for patients after the vaccination from the trained pharmacist, and we're still waiting on the data. We're working on publishing some patient experience and satisfaction.
Okay, thank you so much. That's great, actually. Thank you.
Thank you, Dr. Umayma. Actually, I see many questions in the Q&A for Khalid. I will try to pick those which are really interesting and good to know by the audience. So Khalid, can you tell us about the change in the antibiograms after changing the policy? Is there a change in the national and local antibiograms? Were you able to detect that?
No. So yeah, as I mentioned earlier, we don't have information about like clinical outcomes or resistance. This need to be studied separately. This was the first study, and inshallah we'll try to do more studies in terms of like outcomes and resistance, although it's not easy to get. I mean, for example, to have the resistance from like nationally, how can you do that? It is very tricky, by the way, because when you so you said, Dr. Dalal, the question said antibiogram. Well, antibiogram also, represent the resistance inside the hospital, if you don't control the prescription inside the hospital, just prohibiting dispensing in the community pharmacy without prescription will not be enough. And even if we did this study, to be honest with you, and let's say we didn't find a reduction in resistance, maybe because the misuse inside the hospital got worse, and it's difficult to get the antibiogram just from the community or just from the community acquired infections. So I think the study is very difficult to be done for this reason.
Okay, so looking forward to what will come up regarding this, Khalid. It was interesting. Thank you. So now, sorry, we will have to close the Q&A session. However, our panelists are, of course, ready to take any questions from someone who would like to reach out to them in order to spread the initiatives. We would like now to finish this panel discussion by a small poll. So can we please go to the polls? So we're going to ask our audience to kindly vote for our 3 case studies. I will remind you again that case study 1 was about immunization certification program presented by Dr. Umayma from the Saudi experience. The second initiative was the educational initiative about pharmacy student-led virtual AMR. And the third was about prescription-only antimicrobial use by Dr. Khalid. So the first question in our poll, which initiative are you most likely to implement in your country? Kindly choose a single answer and submit your answer. So I will remind you that please, our attendees, please vote for the panelists. And I can see now that the poll has been submitted. So can we see the results of the poll? Okay, so which initiative is most likely? 39% go to initiative 1. We will go now to the second question. So which initiative can be implemented most quickly in your country? So again, I remind you please to poll for the panelists' initiative which you mostly liked. So the education initiative in case study 2 by Dr. Samar took 50% in terms of the time to implement. Thank you everyone for the poll, and we're going to go now to the third question. So which initiative do you believe to have the biggest impact in your country? Also, please, would you check or choose a single initiative which you think will have the biggest outcome or impact? So we have 32% for the 2 case studies from immunization and from Lebanon in education, and we have 35% for the biggest impact regarding the case study of the inhibition, the prevention of prescription of dispensing without prescription. So thank you everyone for contributing to our poll and for the nice discussion in this presentation. Can we move please to the last slide? So please, I would like to remind the audience to register to our global event. So would you like us to mention the results of the poll? or Khalid?
Yeah, I think that the results will be announced later, to my understanding.
Okay, so the results of the poll will be announced later, and the initiative which was most voted will be presented in our global event, which is please register to our global event, which includes all the WHO regions regarding antimicrobial stewardship on the 30th of November at 11 a.m. CET. And this is going to answer the question of whether pharmacists are protagonists in the fight against antimicrobial resistance. Last but not least, I would like to thank GRIP, the Global Respiratory Infection Partnership, and would also like to thank Reckitt, who are both of them are our partners with the FIP regarding the antimicrobial stewardship program. And the FIP Commission, which was set by the FIP Bureau in 2020, is happy to have shared with you the initiatives during this workshop. And we promise to go on monitoring the progress of our roadmaps regionally and internationally, and to stimulate the global community of pharmacists to be an active force in the minimizing and the mitigation of antimicrobial resistance. Thank you, everyone. It was a pleasure to have you in this workshop. Thank you, everyone. Any one of our speakers would like